Dear friends, colleagues, and partners, today, as we mark World Hepatitis Day, we come together in solidarity with the millions of people whose lives have been affected by viral hepatitis. We remember the lives lost to a disease that is preventable and in many cases treatable. We stand with everyone living with hepatitis, their families and communities. And we recognize the extraordinary people who are driving progress every day, health workers on the front lines, community organizations, people with lived experience, researchers, national hepatitis programs, civil society, donors and partners around the world. Your commitment continues to save lives and bring us closer to a future free from viral hepatitis. This year, our message is clear with the theme, Hepatitis, Let's Break It Down. It is a call to break down the barriers that continue to prevent millions of people from accessing the services they need. Despite the remarkable scientific advances of recent decades, viral hepatitis remains one of the world's leading infectious disease killers and is among the most important causes of liver cirrhosis and hepatocellular cancer. In 2024 alone, hepatitis B and hepatitis C claimed an estimated 1.3 million lives. Nearly 287 million people were living with chronic hepatitis B or hepatitis C, and 1.8 million people acquired a new infection. These are not just numbers. Their lives that could have been protected through vaccination and other strategies to prevent mother-to-child transmission, safe injections and blood transfusions, as well as early diagnosis and timely treatment. Yet there is also reason for optimism. Since 2015, new hepatitis B infections have fallen by almost 1/3, demonstrating the impact of expanded vaccination and prevention. The number of people living with hepatitis C is declining as access to curative treatment continues to grow. These achievements show that elimination is possible, but they also remind us that progress is far too uneven across the regions and even within countries. Today, only around 1 in 4 people living with hepatitis B know their status, and fewer than 1 in 20 are receiving treatment. Millions of people who could be cured of hepatitis C still have no access to diagnosis or treatment. Without urgent action, the world will not achieve the goal of eliminating viral hepatitis as a public health threat by 2030. That is why WHO is calling for action in 5 critical areas. First, turn evidence into action. The world already has the tools to change the course of viral hepatitis. Effective vaccines, reliable diagnostics, curative treatment for hepatitis C, and lifelong therapy for hepatitis B have transformed what is possible. WHO calls on countries to strengthen political commitment, increase investment, and accelerate implementation of proven policy and interventions at scale. Second, put people and communities at the heart of the response. Communities are essential partners in designing, delivering, and improving hepatitis services and programs. WHO calls for meaningful engagement of people with lived experience, civil society, and community organizations in policymaking, service delivery, and accountability to ensure programs are responsive, trusted, and effective. Third, close the gap in access to hepatitis services. Millions of people remain unable to access prevention, testing, and treatment because of where they live, who they are, or the resources available to them. WHO calls for urgent action to expand equitable access to quality hepatitis services with particular attention to underserved and vulnerable population so that no one is left behind. Fourth, integrate hepatitis services into primary health care and universal health coverage. Hepatitis services should be decentralized and integrated into primary health care and universal health coverage, enabling people to access prevention, testing, treatment, and long-term care throughout the life course. WHO calls for a multi-sectoral, people-centered, and human right-based approach to address the broader barriers that prevent people from accessing care. Fifth, invest in innovation and the next generation of solutions. While today's tools can save millions of lives, further innovation is essential to achieve hepatitis elimination. WHO calls for greater investments in research and development, particularly for hepatitis B and hepatitis D, alongside efforts to expand equitable access to affordable diagnostics, medicines, and new technologies. Together, these 5 actions define a shared agenda for accelerating progress toward eliminating viral hepatitis as a public health threat. The World Health Organization will continue to provide global leadership and technical support to countries, working alongside governments, communities, civil society, health workers, and partners to translate commitments into action. Hepatitis elimination is still within reach, but only if we act together for everyone, everywhere, now. Together, we can eliminate hepatitis. I thank you.